clearly individuals as adulthoods need much more support to develop their existing skills. Many individuals with autism develop new skills as they grow older, and it's how you can sort of foster these skills to help them live more fulfilling lives, to encourage their social contacts and so forth. And a recent study, again with Michael Rutter and colleagues, just looking at the presence of savant skills, special skills in autism, showed that even with quite a mixed IQ range of individuals, so going from IQ under 30 to IQs well over 130, a significant proportion had particular areas of skill that were not only out of keeping with their general level of ability, but in many cases out of keeping with the skills of the general population. So particularly good skills in terms of certain cognitive abilities, in terms of memory, in terms of calculating skills, number processing skills, and so forth. So many individuals, even in the lower IQ groups, having potential areas of skill that could really be further developed. And yet very few of this group were using those skills in any sort of socially functional way, because most of them lacked any support or guidance to do so. So moving on into adulthood to develop these skills in a useful way, very important aspect to be addressed. We also need to address much more effectively the factors that lead to mental health and other problems in adulthood. And I've already referred to the lack of structure that many people experience once they leave school. So life becomes much less full, less predictable. And under those circumstances, people with autism, clearly there's very little for them to do on a day-to-day basis. They become bored. With boredom, you get more in the way of ritualistic and stereotype behaviours. They have very little contact with the outside world, so self-esteem often goes right down. And the lack of friendships, the lack of activities that they're typically developing peers can engage in is another major factor. Another major problem is the continuation of childhood behaviours that may become much more unacceptable with age. So some of the special interests, the behavioural habits that are shown by little children, which may not cause huge amounts of problems, can cause real difficulties subsequently. And just one example, this was a man who as a little child was fascinated with red Wellingtons. So his parents would go to jumble sales, second-hand sales, and he had a house full of red Wellingtons. And when he did some good work, when he was well behaved, he got a red Wellington as a reward. So very effective reward, very helpful in lots of ways. But as time went on and he got bigger and bigger, he got a bit bored with red Wellingtons and much more interested in very expensive red leather boots or red high-heeled shoes, which he would then try and get from any source he could, including going into shops and removing them. But also, more worryingly, if he saw anybody with red shoes, I can't see anybody here, but he would go up to people wearing red shoes and start stroking the shoes or trying to get them off the person, which might sound amusing to the audience here, but actually to the people who were on the recipients of this was actually very frightening. And when he came into adult psychiatric services, he was diagnosed as having a sexual perversion around shoes and treated for this. Whereas actually it wasn't, I don't think it did have sexual components, but it had gone from being a really quite innocent behaviour to something that got him into a great deal of trouble. So it's sort of seeing into the future and managing behaviours like that from an early age that's very important. We also need to do much better in developing therapies to address fundamental deficits in things like social understanding, emotional awareness, and theory of mind, and so forth. But really, we don't have a great deal of knowledge on how to do this effectively, and none of the adult research in this area has been anything like of the rigour and the high-quality methodology that one heard about yesterday, for example, in the programmes of working with young children. And okay, there's various strategies available to develop social skills. There's social skills groups, social stories, social scripts, programs to try and develop theory of mind and so forth. But for a start, they're all very much child-oriented. And the results, although they work in an experimental setting, there's very little evidence that they generalise to outside. So, okay, people in social skills groups do better in social skills groups in that setting, but evidence that they're really much more socially competent outside simply isn't there. So very little generalisation to other settings. And of course, these programmes often start very late. And if they're going to work, really they need to be starting much earlier and carried out in a far greater range of settings. And then, of course, we've got cognitive behaviour therapy. Clearly, these people very often have major emotional, mental health, anxiety problems. And there is a small but growing number of RCTs that have been used to try and help people with difficulties like anxiety, anger, or social skills more generally. But again, they've been very much adolescent-based. There's no really sort of high methodological control studies of older adults. Very often the outcomes reliant on whether parents say things have got better or not. If you ask the adolescents themselves, they're often a lot more sceptical about the results and a lot less positive than their parents are. And the main problem, of course, is the lack of evidence that the cognitive behaviour therapy that may have reduced anxiety in the clinical setting has actually done so in real-life settings. And also, it's very evident that if one's going to use cognitive behavioural techniques, there needs to be an awful lot of modifications to suit the very specific difficulties of individuals with autism. So then the programs need to be much more concrete, much more visual, need much more, the sessions need to be short, the goals need to be broken down so they're much shorter term. And also, certainly in my experience, you don't get anywhere unless parents are involved, because we've been singularly unsuccessful in persuading people with autism to do homework assignments, for example, and unless the whole family is involved in the sort of cognitive or behavioural work, the effects are really very limited. Then, of course, there's a really urgent need to improve other opportunities for real social inclusion, and particularly opportunities for work. Many of the job placements that even very able people with autism have are very low-level skills, poorly paid jobs, often voluntary or sheltered workshops. And with help, it's clear that people can enter the job market, can be earning a proper wage and so forth. And a supported employment scheme that I was involved in with the National Autistic Society some years ago showed that with a lot of work with local employers and big companies, one could get people into work, and over a 5-year period, we were very successful in getting a significant numbers of people, not only in work, but in quite high-level and well-paid jobs as well. So getting people into computing and technical jobs. So rather than them being the people pushing the trolleys in the supermarket car park, for example, they're the people in the control rooms of the supermarket, controlling all the stock and so forth. But it's often not possible for them to attain this level of job expertise by themselves, so supported employment workers being very important there.